10 days after graduating medical school, I was diagnosed with leukemia. I received a bone marrow transplant that saved my life, and I found myself in awe of how great our healthcare system was at taking care of me when I was sick. But I soon realized that the excellent care I received was only part of the care I needed. You see, after I went home, and because of the things the transplant did to my body, I became chronically unwell. I had to start caring for myself in a way I never had. I had meds I needed to take and exercises I needed to do. I had nausea and pain and fatigue I needed to manage, and tests and appointments I had to organize. And even when I wasn't feeling well and all this work seemed to be keeping me from doing the things I really wanted to do, I knew I couldn't get stressed or anxious or sad, because if I did, it would only make things worse. To be honest, there were times when it felt overwhelming, and my wife and I would get frustrated because it seemed like too much of my health was dependent on us. It felt like the healthcare system didn't want to support my efforts to be well. Now I realize that it simply couldn't. See, the truth is we designed our healthcare system at and for a different time. We started building it in the early 1900s when people were sick and injured, and it seemed like the only work that needed to be done was the work that doctors and nurses did. After all, the top causes of death were things like pneumonia and the flu, and since we just started developing things like vaccines and antibiotics, which were essentially cures, all we really needed, as far as anyone knew, was just a system that could deliver treatments effectively. All we really needed was sick care. We live in a different world today, and we know better. For example, today, 7 of every 10 deaths and 80% of all healthcare costs are the result of chronic, ongoing conditions. Things like diabetes, heart disease, and depression, or in my case, something called graft versus host disease. These are, of course, the sorts of diseases that don't even have a cure to deliver, but they're also the sorts of conditions that are mostly managed and prevented not by the work that doctors and nurses do, but by the work that we do every day of our lives. It's the choices we make and the lifestyles we pursue, coupled with our ability to cope with and overcome whatever life throws at us. This is the work of being well. It actually has a far greater impact on our health than the sick care we receive, and yet our healthcare system is not designed to support it. But there is a way that it can. You see, over the last several decades, physicians and scientists have worked closely with patients to develop interventions that can support our efforts to be well. The effective ones are called evidence-based programs, and what they show us is that in order for us to be well, we need a few basic things. First, we need to know and understand the parts of our health that really are under our control and what we can do about it that actually works. Secondly, we need supported time and space in which to practice what we learn. And lastly, and perhaps most importantly, is we need to know we're not alone. We need to know that our struggles and our fears are normal. Consequently, most of these interventions involve getting groups of people together that have some common health concern to go through a specially designed curriculum that's often delivered by trained facilitators that actually have a personal connection to the same concern. And what we find in trial after trial of these programs is that when you support people in doing the work sick care can't do, you get results sick care can't give. For example, when people with chronic physical or mental illness participate in a program designed to help them self-manage their health, we find that they feel better and that their quality of life improves. Similarly, when older adults participate in a program designed to help them avoid a fall, we find that they fall half as frequently as they otherwise would, allowing them to maintain their independence. There are programs that help people cut the risk of developing diabetes in half, and programs that help people with chronic pain hurt less and get more satisfaction from their lives. And those are just a few examples. Actually, there are hundreds of proven ways for people to support one another in doing the work sick care can't do. The National Cancer Institute even has a registry of these sorts of interventions if you want to look them up. Same with the National Council on Aging. I mean, it's not a secret. We know how to help people be well. We even know that helping people be well saves money. About $5 saved to every dollar invested. No, the problem is not that we don't know what Wellcare is or whether Wellcare works. The problem is that Wellcare does not fit in a sick care system. And this is why over the last few years, my team and I have focused on doing the proof of concept work to show how a Wellcare system could function. A system based in communities but integrated with and supported by the existing sick care system. We've trained individuals from the community to deliver evidence-based programs in churches and schools and libraries and workplaces, and in partnership with a Rochester-based software company, developed a scalable technology that allows them to work closely with one another and with clinicians in the sick care system. And as a result, patients like Juan, after being diagnosed with diabetes, no longer have to feel alone and abandoned by a system not designed for them. Rather, they're being referred directly to people from their community. People like Alma and Magda, who've been trained to deliver a highly effective diabetes self-management program in Juan's native Spanish. A program that will, of course, improve Juan's clinical outcomes, but that will also give him hope for the future and help to save his struggling marriage. You see, the point I'm trying to make is that the situation we are in as a society is not unlike the one in the early 1900s. We know what improves health, but will we commit now to building a system for Wellcare like we did then to building a system for Sickcare? Will we allow people like Alma and Magda to be part of the healthcare system? Will we allow communities to be more than passive recipients of Sickcare? Will we enable them to be active partners in the provision of healthcare? I've searched high and low for a good reason why we shouldn't, and I can't find one. 10 days after I graduated medical school, I was diagnosed with leukemia. I received incredible Sickcare that saved my life, and yet I felt like something was missing. 6 years later, I stand before you with a dream and a plan for making healthcare more than Sickcare. Let's build a system for Wellcare, and let's make that system available to everyone, everywhere. Thank you.